Hello. Today we're going to take a brief look at the window shopping tool available on Healthcare.gov. Now, this tool allows you to see plans and prices available on the marketplace based on zip code. And it's a great resource for you to use to become familiar with the plans available in your area. And it also allows clients that maybe aren't ready to submit an application just yet to view an estimate of the premium tax credits for which they may be eligible, as well as the available plans and benefits should they choose to enroll in a marketplace plan. Let's go ahead and get started with the first step of entering the zip code of the client's physical address. And today we'll be using the zip code for the Toledo area. We'll go ahead and select the county for that physical address and click continue. And you can see there are 3 easy steps to this tool to be able to view the health and even dental plan information. Now, during this training, though, we will actually skip over the second step. And in that step, it would allow you to customize the plan information that's displayed based on individual client circumstances. So, such as entering their unique income or the number of household members they have. Right now, we're going to go ahead and jump right to step 3 to view the available health and dental plans. This will allow us to get a more general idea of the types of information available on the window shopping tool. And so what we'll be viewing right now is going to be full price plans available for somebody age 35 in Lucas County. You can see here in Lucas County, there are 106 plans available, but do keep in mind that in many cases, the client's budget or their specific healthcare needs will help to limit the number of plans that you view in detail. But becoming familiar with many of these plans and especially the different carriers will be helpful when you are assisting your clients so that they can better understand the benefits available in the plan that they select. So let's view the filters here. You are able to add in a monthly premium range for the yearly deductible, whether the plan is eligible for HSA, can come down into the different metal tiers and view only bronze or only silver, gold plans, etc. Should there be other plan types, such as POS, EPO, or PPO plans, you would be able to view those here as a filter option as well. You can filter by specific insurance companies and even the medical management programs that the plans may offer. Helpful filters here are also the medical provider and the prescription drug filter. And we're going to go ahead and add in a couple of providers and facilities as well as prescription drugs so we can see what that view looks like on the next page. So here we'll start with a Toledo area hospital, St. Anne. You can see that there is a general acute care hospital. We'll click add. We will also add in a specialist cardiologist here. And you can see, again, it's in Toledo, so we know we're getting the right provider. And a family care provider. So we've added the 3 facilities, and we can click continue. We'll also want to come back and add those prescription drugs. We'll add in a couple of common ones, metformin. Oftentimes your client will have information on the dosing. Right now, we'll just pick one here and add in as well omeprazole. Continue. One last time, we'll come back into the filter option. And we'll want to view the silver plans for now. These plans are often the sweet spot for many individuals, and that sweet spot of offering lower monthly premiums and the lower cost sharing amounts. We'll take a look at those for now. You can see that by adding just that one filter of viewing the silver plans, we've now reduced the number of plans displayed here to 45. The silver plan with the lowest monthly premium is the Aetna CVS Health Silver 5 plan. Again, this is a full cost premium that it's displaying right now. You can see a lot of important information right from the jump here on this plan detail summary. We've got the plan name, the yearly deductible, and out-of-pocket max. Now these are listed for an individual. Should you enter information for a household, you'll see the family totals as well. You can see primary care, specialist, urgent care information listed here. And then those providers that we added, as well as the medications, are also listed here with the green check mark indicating in-network or covered in the formulary, and the red X indicating out-of-network, or should there be a red X here, not a non-covered medication. So we can click in here on this first one to get additional details. Have again that summary here at the very top, the highlights of the plan. We can come in and click on these caret drop downs and view additional details for each of these. For example, in the plan documents, summary of benefits, plan brochure, provider directory, and that list of covered drugs or the formulary. Oftentimes, the summary of benefits is pretty helpful for clients, especially after they have chosen a plan. But all of this information that's included in the summary of benefits is also listed here on these drop downs. So we can see, again, by clicking the caret, costs for different medical services, the deductible out-of-pocket max, primary care provider. So should a client visit the PCP, it would be $50 per visit from day one, not subject to the deductible, whereas X-rays and diagnostic imaging would be a $30 copay after the deductible. You can see those differences and how those are displayed here. We continue scrolling down. We can see prescription drug coverage information, the different tier levels, generic being tier level 1, preferred brand name tier 2, et cetera, et cetera. And these may differ based on the different carriers. And so you will want to take a look at this information, especially if an individual is taking regular prescriptions. You can view additional information on doctors and hospitals. Takes you right to the provider directory. When you click on these, they will take you to a separate site via the insurance carrier. Oftentimes, they will try to prompt you to log in or create an account, which is normally not necessary. You can add in those additional details on the different providers you want to check on for being in network, and should be able to view that fairly easily, but they will differ based on the insurance carrier. So something you may want to test out. I can continue on here, look at urgent care and hospital services. This is another popular area that many will want to know about. So urgent care would be $50 per visit from day one. So again, not subject to the deductible. Whereas emergency room care would be a 50% coinsurance after the deductible is met. This is helpful here for different conditions to give a rough estimate of what those costs, expected costs, can be. So for a healthy pregnancy and normal delivery, with this plan, it would be expected to be about $8,955 total out of pocket for that individual, type 2 diabetes, and then a simple fracture. And these stay the same across all plans. So you can see that and compare that information plan to plan. Any adult dental coverage or child dental coverage would be listed here. That is not a benefit offered by this plan. Medical management programs can see if there are additional management programs available for asthma or diabetes, pregnancy, and in this case, weight loss programs are not available via this plan. Other services provides additional details on acupuncture, chiropractic care, especially important mental and behavioral health, outpatient and inpatient services. So you can see that outpatient would be a $50 copay before the deductible, whereas inpatient services would need to meet the deductible and then have a 50% coinsurance. So this is the very detailed view that you can see plan by plan. Another helpful view in this tool is to click the compare button on up to 3 different plans. So we'll choose this Aetna plan, come down and choose a Molina, as well as a CareSource plan. Come up to the very top and click compare 3 plans. And now you can see plan information that we just went over side by side. So in case your client is debating between 1, 2, or 3 different plans, they can view those details side by side. Now you will see here the easy pricing flag. And now briefly, as an easy pricing plan, or also known as a standardized plan, these plans have benefit design components like the deductible and cost sharing limits and copays at each of the metal tier levels that are set. And so they're going to be the same across carriers for these specific plans that are marked with this easy pricing notice here. And now offering these standardized plans is hopefully going to make it easier for consumers to make apples to apples comparisons across plans and reduce confusion among those consumers. The standardized plans allow people to shop and plans to compete based on the premium price, their network quality, their formulary, and then the client can ignore all other aspects of the benefit design. They'll be focusing in on those three items: the premium, their network, and the formulary. So it helps to narrow down the plan options for individuals. And then you can see here the difference with a non-standardized plan via Aetna. The deductible is different out of pocket. We can even get down and see within the copays that those differ significantly between the plans. So again, I encourage you to open up this window shopping tool over the next several days in preparation for open enrollment, and just become familiar with the plans available in your service areas. Being familiar with which hospitals, urgent cares, and maybe even some of those larger clinic systems or providers, perhaps for mental health care services, can all help when you're working with your clients one-on-one.